I'm the local chapter leader of Strong Towns Las Vegas. We promote alternative planning ideas from the status quo, from what we've had for decades, something that's more traditional. We promote something that's transit-oriented, mixed use, which what the bill really represents. Is something that's more walkable and bikeable. We will echo the previous comments. This bill highly reflects that. However, we want to make sure that street design also matters. We want to make sure that the new development is essentially surrounded by streets where people can walk and get around by bicycle. We're excited that infill development is being promoted. We do not want codes and regulations getting in the way, which makes it more and more difficult. So we hope this bill passes. We hope that this will shake things up, and I can't wait to get started. Thank you so much.
Thank you so much.
Henderson. I'm the Deputy Director of the Nevada Conservation League. We are here in support of AB 241, a bill that we believe takes an essential step to encouraging infill development across the state. Recent polling confirms that over 75% of Nevadans support using existing underutilized lands and infill development for housing rather than selling off our treasured public lands. Infill offers numerous environmental benefits, including reducing urban sprawl and preserving natural landscapes. At the same time, it can lower emissions and reduce traffic congestion. With that, we urge the committee support, and thank you for your time.
Madam Chair, good morning, members of the committee. For the record, John Sandy, S-A-N-D-E, here today on behalf of the Nevada State Apartment Association. As we've been discussing this morning, Nevada's facing a serious housing shortage. More than half of the renters are cost burdened, spending over 30% of their income on rent. The single most effective way to reduce housing costs is to increase the housing supply. As one of the attorneys for our association typically says, he says there's not a single issue between landlords and tenants that can't be solved by doubling the housing supply. And what he means by that is doubling the housing supply would bring down costs. It would make landlords compete with one another for those tenants. It overall will make our housing better, and that's what this bill is seeking to do, is increasing that housing supply. This type of policy doesn't just improve affordability, it helps revitalize underused commercial areas and supports walkable, vibrant communities. In short, AB 241 is a smart land use policy with immediate long-term benefits. Senator Daley's gone, but Senator Scheibel might remember, in the Assembly, I recalled a similar project up in North Reno. There used to be a Kmart up there that some young developers, they're actually around my age, and they did this a number of years ago. I was so impressed by it, but they took that Kmart parking lot and built a beautiful apartment complex up there. And so when I envisioned this bill, I envisioned projects like that, what can revitalize areas of a community, especially when they're non-productive commercial sites. And so we would urge your support of this bill, so thank you.
Thank you, Mr. Sandy. You said Senator Daley's name and he appeared. It was like magic.
Good morning, Chair Pazina, members of the committee. Thank you for the opportunity to appear today. For the record, my name is Cassidy Wilson, C-A-S-S-I-D-Y, W-I-L-S-O-N, with McDonald Carano. I'm here today representing the Builders Association of Northern Nevada. The Builders Association was founded in 1956 and represents more than 700 companies and advocates on issues affecting residential development and home building across Northern Nevada. The Builders Association of Northern Nevada, BAN, is in strong support of AB 241. We all share a common concern, the high cost of housing in Nevada and the barriers it creates for individuals and families who aspire home ownership. These prices are not arbitrary. They're a result of basic economics, high demand and little supply. Just last session, in a bipartisan effort, this legislature passed AB 213, led by Majority Leader Howdigy, affirming that consistent and robust supply of housing is an important factor of overall affordability of housing. AB 241 builds directly on that principle. AB 241 will help streamline the process and unlock new opportunities for housing development, particularly in multifamily housing. Multifamily units are a critical component of our housing supply. They offer an affordable and attainable path for homeownership, especially for first-time homebuyers and working families. They also create housing stability and a foundation to build equality, the cornerstone of financial security of many Nevadans. We want to thank Majority Leader Howdigy for continuing to champion supply side and solutions for our housing crisis. Thank you very much.
Good morning. For the record, my name is Vincent Guthreau, spelled V-I-N-S-O-N, last name Guthreau, G-U-T-H-R-E-A-U. I'm the executive director of the Nevada Association of Counties. I'm here on behalf of all 17 of our members. I echo that we're sort of here under the rules of the committee. We want to thank the majority leader for working on the amendments and the ones that she considers friendly, which include the carving out of the Clark County Airport and then the Harry Reid International Airport and also the Lake Tahoe Basin. So we appreciate her acceptance of those. Our members at NACO understand and share the goal of the sponsor's bill for infill and mixed use, and we believe that there's a current process that accomplishes this goal, and I think streamlining it isn't the worst thing, but I do think we need some provisions to allow for our members to reflect the unique characteristics of each of their communities. We believe, again, reflecting what the previous testifier said, there are some amendments floating out there. The sponsor also mentioned them that would move us, I think, to a different position. So I want to put that on the record for our members. And I just have one last item. I know there was a question around data. I do have some information from Clark County that since 2022, they have not denied an application for a multifamily project. So that was asked by the committee. I want to put that on the record for folks just because I happen to have it on me. So other than that, thank you very much for the opportunity to testify.
Thank you so much, Mr. Guthreau, and also Mr. Hardy for answering some of the questions that had been asked. And we are going to move to Las Vegas. We thank you for being here and ask you to begin when you're ready.
Good morning, Chair and Committee. My name is Jill Douglas, D-O-U-G-L-A-S-S. I'm speaking as a concerned citizen. I stand in opposition to AB 241. I previously testified against this bill when it was in the Assembly. In my opinion, this is state government overreach. While well-intended, I'm concerned about the bill's impact on existing zoning laws and community planning. State-mandated changes may override local control and ignore the voices of affected citizens, and may lead to developments that are inconsistent with community character or infrastructure capacity. I'm also concerned about potential strains on public services and resources resulting from increased population density in areas originally designated commercial use. Local governments and citizens affected should be engaged and involved, preserving local autonomy and community integrity, not the state government. Please vote no on AB 241. Thank you.
Good morning. My name is Kimberly Johnston Linsday, Linsday, and I want to say thank you to Senator Daley for his questions and the points that he's made. I respect that, and I also want to ditto Jill Douglas. That's all. Thank you.
Good morning, Madam Chair, members of the committee. For the record, John Sandy, S-A-N-D-E, here today on behalf of the Nevada State Apartment Association. Want to say how much we appreciate the majority leader and her passion for housing issues. Unfortunately, however, we do have some concerns with this bill. Not as relates to the disclosure of fees. We actually supported similar legislation that was proposed last session. What I am here to express our concern about is the portion involving rent control. While rent control aims to make the housing more affordable, extensive economic research indicates that over time, it often leads to reduced affordability, fuels gentrification, and creates negative spillovers in surrounding neighborhoods. For instance, in a study by the Brookings Institution, they found that rent control may provide short-term relief for current tenants, but the long run, it decreases affordability and contributes to gentrification. Moreover, rent control would lead to a decrease in the quality and quantity of available housing. Landlords facing capped revenues may be less inclined to invest in property maintenance, resulting in deteriorating housing conditions. A comprehensive study highlighted that rent control often leads to reduced housing quality due to landlords' diminished incentives for upkeep. Additionally, rent control policies can discourage new housing developments, exacerbating housing shortages. For example, after an implementation of strict rent control measures in Montgomery County, Maryland, multifamily property transactions decreased by 13% in the first 3 quarters of 2024 compared to the same period in 2023, indicating reduced investment in housing. In light of these findings, it's critical to consider alternative solutions to addressing housing affordability without the adverse effects associated with rent control. Policies that promote increased housing supply, such as incentivizing new construction and reducing regulatory barriers, may offer more sustainability outcomes for our community. And want to say that I know the majority leader has engaged in efforts to increase housing supply. However, we just really have concerns about this effort as it relates to rent control. So thank you for your time. I really appreciate it.
Thank you. And I would point out this is incredibly narrow and only a pilot program, but we thank you very much for your comments. And we are going to go to those that have joined us in Las Vegas. So welcome, and please begin when you're ready.
Good morning, Chair Pazina, everybody. Thank you so much. CYRUSHOJJATY. We appreciate the efforts, but we will echo the comments made by the previous speaker. I yield my time.
Chair Pazina, members of the Senate Committee on Commerce and Labor, my name is Anahit Bakhshetyan. For the record, that is ANAHITBAGHSHETSYN, and I'm a research assistant at Nevada Policy. Today, Nevada Policy comes in opposition of AB 280, and as the testimonies before me echoed, the reason is not the disclosure of fees, rather it is the rent control pilot program that is being proposed. Rent control, even in limited forms and in limited scope, creates a serious long-term consequence for the Nevada's housing market. Limiting rent increases to 5% for a subset of tenants may offer short-term relief for these retirees that we heard about today, but it also distorts the price signals to allow housing supply to adjust to the rising prices and also the rising demand. Because of the vague criteria, additionally, this program might attract people who are retirees, but also who can afford rent increases. This kind of restriction discourages new construction, disincentivizes investment in existing rental properties, and particularly in a state where housing availability is already lagging behind the population growth. The impact is also going to be huge on the small landlords, as Senator Ellison mentioned earlier. Many of these individuals rely on rental income solely to keep up their everyday activities and their regular streams of income. So blanket caps on rent, even if temporary, even if segmented, will have a negative impact on the small landlords. Additionally, it could have just a chilling effect on entire housing ecosystem and signal to future landlords that rent controls are on the table and are something that the legislature will be considering in the long term. So for these reasons, Nevada Policy stands in opposition. Thank you very much.
Good morning, Chair and members of the committee. My name is Deborah Costello, DEBORAHCOSTELLO, and I am the Executive Director of First Choice Pregnancy Services, one of the busiest pregnancy resource centers of our kind in the nation, and a provider of free abortion pill reversals. Let me share with you just a few of the heartbreaking stories we've encountered at our center from women who took the abortion pill. One mother brought her tiny baby, approximately 7 weeks old, into First Choice Pregnancy Services in a sandwich bag. She asked if everything that was supposed to pass after taking the abortion pill was there, desperately seeking answers in the midst of her heartbreak. Another mother shared with our sonographer the traumatic story of her chemical abortion. She recalled almost reaching the bathroom when, at just 15 weeks, her baby unexpectedly delivered onto the floor. For 3 days afterwards, she battled swelling and a high fever, ignoring the symptoms until a concerned friend urged her to seek medical help. At the hospital, she learned the devastating news: she had been carrying twins, and the second baby was still inside, causing a life-threatening septic infection, and had to undergo a surgical abortion. Since that day, she said she had been haunted by the nightmares every night. Another young woman, just 28 years old, shared her heartbreaking story with us. She had taken the abortion pill to end her only pregnancy, unaware it would lead to a devastating complication requiring a full hysterectomy, robbing her of the ability to ever bear children in the future. These are not isolated incidents. These are real women suffering real trauma, often in silence and often alone. Removing the prescribing physician's name from abortion pill packaging only worsens that isolation. It sends a chilling message: you're on your own, no provider to call, no one responsible, no face to the decision that ended a life and shattered another. I urge you, for the sake of transparency, responsibility, and the safety of women of Nevada, do not strip away the last thread of accountability.
Thank you so much. We're
Please
actually
vote
well
no
over
on
2
AB
minutes.
411.
Thank you so
Thank
much
you.
for being here. Our next speaker, please, in Las Vegas. And again, we can take 4 more in Las Vegas.
Good morning, Honorable Chair and members of the committee. My name is Elishaba Delote, Delote. I have been an RN surgical charge nurse for 20 plus years, and I oppose AB 411. Why? Because it poses a serious threat to women's health, medical accountability, and emergency care in our state. I strongly oppose this bill and I urge lawmakers to prioritize patient safety and responsible healthcare practices. There are 3 things I want to highlight. Risk to women's health. By potentially reducing oversight of mifestrone prescription, AB 411 could expose women to severe physical and mental health risk. Without proper medical supervision, complications from medication abortion, such as excessive bleeding or infection, could go undetected or untreated, leading to life-threatening situations. Women deserve comprehensive care, not policies that prioritize convenience over their safety. Second, weakening doctor accountability. This bill also risks letting prescribing doctors off the hook. Inadequate patient screening, insufficient follow-up care, and the potential for overprescription could become more common under AB 411. When doctors aren't held to high standards, patient trust erodes and women are left to face the consequences alone. Accountability must not take a backseat to administrative ease. Third, challenges for emergency personnel. Finally, AB 411 could burden our emergency responders. Without clear records or communication from prescribing doctors, emergency personnel may lack critical information when treating mifestrone-related complication. This delays care, putting both patients and responders at risk in medical crisis. I urge the Nevada legislature to reject AB 411. Any policies changes must put
Thank you so
patient
much. We're at
safety,
2 minutes, and I want to get more
accountability.
people in Las Vegas and more people on the phones. But I would encourage you to, everyone who's had
Thank you.
additional testimony, to go ahead and turn that into sen.state.nv.us so we can have that all of that testimony recorded for the committee. And we thank you. Our next speaker, please.
Hi, good morning. My name is Grace Trujillo. I'm a PHN. I've been a PHN for 20 plus years. I've worked with a lot of high-risk pregnancy patients in the clinic, in the hospitals, in the different situations. I oppose this bill based solely on what my experience. You have never been in a situation in the field to talk with clients. Imagine you are a father, picks up this medication for his wife, prescribed managed high-risk pregnancy, and the label reads Desert Medical Group, but he has no idea which doctor made the decision. Later, he learns the dosage was incorrect or a mistake that could have been caught if he could trace it back to a specific practitioner. Instead, he's left navigating a maze of bureaucracy, unsure who to trust or blame. This isn't just inconvenience, it's dangerous. Mistakes happen, but hiding the prescriber's identity under this bill makes it harder to correct them, protect patients, ensure justice. We are supposed to be an advocate for patients, not thinking for ourselves when we are in the medical field. Current law requires the prescribing practitioner's names on the prescription labels for reason. Transparency, as mentioned by everyone, and it ensures patients know who is responsible for their care, fosters direct communication, and upholds accountability. Replacing that with a generic healthcare practice strips away our ability to connect with the human being behind the prescription and the doctor who knows our history, our needs, our fears. It's a step toward depersonalizing medicine at a time when we need connection more than ever. Proponents might argue this change protects practitioners' privacy or shields them from harassment. I understand those concerns, but blurring accountability on prescription label isn't the answer. It sacrifices the patient's safety for the sake of the patient, and that's a trade-off we cannot afford. Knowing the doctor's name on every prescription gives patients confidence to ask questions, seek clarification, and build trust.
Thank you so much for being here. It is 2 minutes, and we only have about a minute left of our 20 minutes, and I need to hear from at least 2 more in Las Vegas, as well as on the phone. So we thank you, and we're going to have you close out those comments. But thank you so much, and please send your full comments to the Senate address on senatecl@sen.state.nv.us on the agenda so that we can have all of your comments, and we thank you so much.
I counted my time. It was not even 2 minutes.
We actually are counting here as well, and we thank you so much again, but we do need to move to the next speaker so we're not missing those waiting on the phone. Next speaker, please.
Chair and members of the committee, thank you for this opportunity to speak today. My name is Jill Douglas, Douglass, and I'm speaking as a very concerned citizen. I rise in strong opposition to Assembly Bill 411. This bill seeks to remove the name of the prescribing doctor from the abortion pill prescription, a move that raises serious concerns about transparency, accountability, and patient safety. In every other area of medicine, the prescribing physician is clearly identified. Why should abortion be treated differently? To be clear, removing the doctor's name severs the vital connection between patient and provider. If a woman experiences complications, and we know that that can happen, there are very serious side effects, hemorrhaging, infection, incomplete abortion. How does she or her family know who to follow up with? This bill doesn't empower women, it abandons them. It also opens the door to potential abuse. Without prescribing doctors' information, how do we ensure that the prescription was issued legally? How do we hold bad actors accountable, especially in cases where pills were being distributed illegally or without proper screening? Nevadans deserve a healthcare system rooted in transparency and responsibility. Shielding providers from accountability is not healthcare. It's a political cover at the expense of women's safety. I urge you to reject AB 411. Let's not carve out special protections that compromise medical standards and public trust. Thank you.